Yes, I'll thank you for the invitation, and I'll be telling a bit more about how labeling health apps can contribute to a healthier global community. First of all, the work that we've been doing was an assignment from the European Commission that went global with the cooperation of ISO. And the background of the context, the European policy in this field is we have a number of health challenges in Europe, including an aging population and chronic diseases, putting pressure on health budgets, unequal quality and access to healthcare services, and a shortage of health professionals. Three pillars address these issues, and one of them is digital tools and data for citizen empowerment and person-centered healthcare, in which common principles are developed and certification, which are to lead to more uptake of health apps in this case in clinical care pathways and more funding, structural funding, including reimbursement by health insurers to enable this person-centered healthcare with digital tools. There's a rationale behind it. This is a study from 2013, which estimates the total healthcare cost savings at 99 billion a year if within the European Union we utilize health apps to the extent possible. As you can see, it does cost a little to add to the workforce, but all in all, still 99 billion. And if people are healthier, they can also work, pay taxes, contribute to GDP, and that is estimated at another 93 billion. On top of the cost savings for the health system, there's also a potential for small and medium-sized enterprises and larger enterprises too. There are now an increasing number of health apps who are very promising. I work a lot in oncology, and this is a study in 2016 that if patients monitor on a weekly basis their symptoms, 12 symptoms, the communication with their clinicians improved a lot, and with the adequate follow-up, they were able to live 5 months longer with more quality of life and less hospitalizations. What you see, unfortunately, until now, is that this is not yet clinical practice. This is research from 4 years ago, but it doesn't mean that every cancer patient actually gets this. Which is part of my drive to work in this field. This is my late husband who died of a brain tumor in 2012, and I've initiated 2 health apps in oncology that are heavily researched and aiming to go into clinical practice in the next months to years. So we're trying to create benefit for patients, for industry, for health systems, but there are a number of key adoption barriers, including lack of clarity on mHealth certification, lack of reimbursement mechanisms, and lack of awareness of mHealth benefits. And we're addressing all with the work that we're doing. And as you can see, there are a number more, but these are worth mentioning. Some other research that was done: what do patients and carers need in health apps but are not getting? People say, well, there's so many health apps, I don't know which one to choose. I'm not sure if they will help me, if they're relevant to me. I'm suspicious of them because I don't know who made them. Let's just prefer face-to-face consultation with the doctors, nurses, which is, by the way, from our research too, it's not giving somebody a health app and then you're done. The best solution is generally blended care, so a good combination of face-to-face care and technology. So what do these people want? They're looking for trustworthy, accurate information, apps that are easy to use, that guarantee that the personal data are secure, that they're free of charge, contain no advertisements, so that leads towards either you work with my data, which is what a lot of people don't want, or there's a reimbursement or another funder. And the last one, work effectively and consistently over time. And you will see these in our work further on. Some Australian research asked into who or what would you trust to give you recommendations on apps for your health. And as you can see here, people trusted Google search least, and then the App Store, and the most were the GPs. Although there are differences, some people do, most people were not that distrustful of App Store. So there's differences there, and the same applies to these others. But what you can see in practice is that they are, they're not, well, they can't access their GPs, or they can't get some feedback from the GP. So the medical providers are the ones that they least use as a source to identify which mental health apps to use. And this was 811 people who on average used free health apps. They relied, they got their input from social media, from personal searches, word of mouth. So that's in this lower end corner, and leased by medical providers. What we're hoping to do with our work is be the source that both the GPs and the app stores can use. So CEN ISO DTS, which stands for Draft Technical Specification A2304 Part 2, in combination with trusted app assessment organizations, is to help people, different stakeholders, to assess what are the health apps that actually suit my needs. Because indeed, so far, if you look at the App Store, the order of the apps, that doesn't signify that the best one is on top. Reviews do not adequately reflect the actual quality, and they can be, as you can see here, from 2013. And this is just somebody said, yeah, love the app, no idea if it's working well, the technology behind it, but then you get the 5 points. And another one says, I have to pay and I give you 1 star. So that doesn't say a whole lot. The same applies to research has been done into the documentation in the App Store. It sounds very scientific, but that doesn't mean that it is scientific in a number of cases. So we do need a bit more. Doctors need a bit more too. So the GPs were the ones that were trusted most, but what they do in the end is they recommend apps not that many times because they have a lack of awareness of health benefits, indeed, a lack of knowledge of effective apps, and a lack of a trustworthy source to access apps. And another research, this was medical students, where they asked, yeah, what matters most to you when it comes to a health app? So these were the items that they valued most. And then they asked, okay, so can you assess the quality in these fields? And as you can see, for most of these items, they could only assess it for some 25%. So it's difficult to see what is a good health app. There are shitty ones out there that can actually jeopardize your health, and there are great ones out there that can be a great contribution that we're not yet taking advantage of. Within Europe, we have a number of health app repositories, curated app libraries. What you see is they often have their own assessment frameworks, which are most often not transparent, and usually only a few dozen apps have been assessed, and research from 2017 says that there are already at that time, 3 years ago, 325,000 health apps. So we still have quite a few to look at. And what you can see, this is research from 2018, where they assessed 20 different app assessment frameworks. So call it a measurement to see how the quality of a health app is assessed. And as you can see here, privacy, 3 of them didn't take that into account, or user experience, 4 of them didn't take it into account. So green says this item was assessed, is part of the assessment method. Yellow says it is in some part, and red, it is not part of it. What was also visible is that the audiences they targeted were very different, and at the most 3. We've looked at all of these different items and included ethics too. So these are part of our assessment frameworks. Where we look at the whole life cycle of an app. We've looked into existing frameworks, And we've added target audiences within our research around the standard that we made, including also consumers, payers, app stores, and app assessors. Another finding from this same study, as you can see here, the 20 different app assessment frameworks, a number of them didn't use standards. And the one that used the most had 18 standard organizations referenced, and we looked at some 35 different standard organizations. So within it, quite a few more, a lot of ISO standards, for example, that we utilized. So what is available? Within the European Union, we have the medical device regulation. As of next year, it will be completely valid, and the medical device directives that are currently still valid are then outdated. The Dutch government they took a sample of 271 apps. Turned out that 21% was a medical device, and only as of class 2A, you need to have it assessed at a notified body. So all in all, only 18% as of next year will be assessed. And as you can see here, even for apps that target the cardiac system, 34 of them, only 20 are medical devices. So there's the idea is that there are much more medical devices, but a lot of them are not. We've been inspired for CEN ISO 82304 Part 2 to do something on the bigger scope. So both the 79% health apps that are not medical devices and the 21% that are. And we've been looking at labels. So here, Nutri-Score label says something about food, how healthy that is. The EU energy label, how energy efficient it is, which is in another form used in China too, as you will see later on, and at the FDA over-the-counter drugs label to create our own first label that we then tested with low health literates. This is going to be the new energy label in the EU as of next year. The energy label is quite a success story. It is recognized in the EU by 93% of consumers and used by 79% when they're buying an appliance, for example, a washing machine. Initially, a lot of the products were lower quality, EFG, and now most are in A++, or A++ or A+. And as of next year, everything that is now A++ will become a B or C to again drive further quality improvement. And yeah, all of the efforts have led to, in some cases, only having A products on the market. This is our final draft label that I will go into a bit more later on. A bit about our testing. So we had different labels, testing it with low health literates, and 1 in 2 people within the EU are low health literate, and we wanted to make a label that was helpful for them in their understanding of what is a good health app. So it was good testing them, and what it turns out to be that if it works for this group of people, then it works better for all of us. What we assessed with them as well is what is going to happen as of next year in the EU with the energy label. As of then, if you buy a washing machine online, you need to have the quality level here mentioned as well, close to the retail price. And if you hover over it, you get the whole label visible to have people assist in what is a good health app, or in this case, washing machine for them. And we did the same thing, adding the overall health app quality level in an app store environment. And if you click on it, you will get the whole label. This is a previous version. What is very nice about the EU energy label is that it is adopted in 59 countries outside of the EU. Including China, by the way, and I looked up a number of these labels, and then you can see that they're actually quite comparable. The biggest difference is in the Arabic world, where left becomes right for the color bars, and that's why we made now 3 different labels, especially for today. We've made a first draft of the Chinese label as well. So we have an English label, we have an Arabic label, where you can see that with different characters and different script directions, it works still too. My Chinese is not as good as I can well pronounce these, but what you can see here is at the top there's a flag or logo, flag of your country, for example, and that it's a health app quality label. The app icon that is usually visible in the App Store, and the app name to make clear what app this is about, which platforms they're available on, who made it, what's the benefit of the app, when you need to first get approval from a health professional before using the app. And then there are scores into how healthy and safe is your app, how easy to use, is your data secure, is the build robust, and that adds up to an overall health app quality score and a date when it is checked. And here you can see the abbreviated version as well. Part of our work, Healthy and Safe, has a number of sub-items, which include health requirements, health risks, ethics, health benefit, and societal benefit. Easy to use includes accessibility and usability, secure data, questions on privacy and security, and robust build, questions on technical robustness and interoperability. And these questions are yes, no, not applicable, and I'll show an example later on. What is good to mention that E in itself is not a bad thing. It's all about intended use and context that determines what quality level is necessary. So as you can see here, this is a man with a mouth mask in the Rotterdam metro. This might actually be, if you would translate it, a red E mouth mask. And on the ICU in Milan, this might be a dark green A mouth mask, which is mandatory here and necessary here, but not necessary here. So it's all about intended use and context to see what health app suits my needs. And what the label can deliver is it can help create a short list out of all of these different apps, and likely context specific or personal preferences will then reveal which app is best for you. Almost. So this is just a page of our work. We have questions, yes, no, not applicable, in total 67, a maximum of 81 questions to get the input, the content for the data too. And this was created with a Delphi study with 90 experts from 8 different stakeholder groups and 6 continents and surveys. And we also have an annex on use cases for who can actually use our work. We hope that it will contribute to more doctors being able to determine what to put in their care pathways, and more health insurers to actually reimburse apps, etc., but also the communication between developer and customer. It can provide a vocabulary in a way. The work has already been included in a toolbox in the EU for COVID tracing apps, and we have already tested it with 11 COVID symptom apps for the Dutch government, and these findings and more on the Delphi study and more on the testing of the label will become available in the next half year or so in scientific articles. Thank you for your attention, and welcome to have questions later on.